how they will bridge the divide between governments, multilaterals, and the private sector. So disease elimination and creating equity in the most underserved communities is not just a medical challenge. It's tied to geopolitics. And that's one of the reasons that foreign policy, why is foreign policy convening such health programming as this? And that's because it's incredibly important that we work together as common humanity to solve these problems. We feel very strongly about that, and we're happy that you're here to join us in that effort. So, some housekeeping. There's a lot of stuff on your chair. Let me tell you about it. There's a QR code on your seat that will take you to the agenda. We want to make sure we conserve and not print too much paper. And one side, you'll click on that QR code, and you'll get to the agenda, speaker bios, and the like. You flip that over, and there's a QR code to subscribe to FP. One of the reasons we're able to do this is through your sustaining subscriptions. So please do. If you don't already subscribe, think about subscribing. A lot of the folks in the room I know already do have subscriptions. We have cool hats for subscribers. They say soft power on the front. Joseph Nye, the dearly departed professor, actually coined the term in Foreign Policy Magazine in an article many years ago. So we're honoring him with those hats here today. We also have reporters on the ground here in New York. They are publishing their SITREP newsletter, Josh Halterwanger and Rishi Iyengar, daily, focusing on all the scuttlebutt happening around UNGA. You'll find instructions on how to access that and sign up for it in the great tote bags that help you think globally. And also, there's some headsets on your seats. That's not for you to zone out and listen to an iPod or music. We're going to have a discussion in a couple of hours that will feature Brazil Portuguese. So we have some specific instructions about that. I think you all know how to use a translation device, but really we want to collect them afterwards. And my colleague, Dr. Maisha Alam, who heads FP Analytics, will explain that a little bit more later when that part of the program comes together. So I think that's it for the housekeeping. But I want to thank our partners. Today's event was made possible with help from the Gates Foundation, Merck, and the Rockefeller Foundation. You can applaud. I think that's very deserving. With additional support from AstraZeneca, Bupa, Cigna Healthcare, and Seed Global Health. Thanks to them as well for supporting the program. Lastly, I am super excited about a brand new foreign policy podcast, which we are just going to start work on. It's focused on where global health could be headed at this moment. And the conversation you're about to hear is actually going to be part of that podcast, of that first episode. That means you're all going to be part of that first episode. So let's get going.
Please welcome WAKI Health Executive Director, Dr. Rosemary Mburu, and Gates Foundation CEO, Mark Suzman, for a conversation with journalist and broadcaster Henry Bonsu.
Are you ready? Yes. Do you mean it? Yes. Fantastic. Thank you very much indeed. It's great to be here. It's great to see you all. The Threshold is a new foreign policy podcast about how to end infectious disease in today's world. In this first episode, I'm delighted to introduce Mark Suzman, Chief Executive of the Gates Foundation, and Rosemary Mburu, Executive Director of WAKI Health, a leading African advocacy organization based in Kenya. And over the next 25 minutes, we'll discuss the future of disease elimination. We've never been closer, but also the challenges have never been greater. Let's start, and I'm a journalist, we'll have to start, with some breaking news from this morning. Gates announced a partnership to expand access to generic lenacapavir. Now, Mark, tell us about... Do I have to take it from the top? I can rewind and come again. I can. Mark, tell us about lenacapavir and why this is so significant.
Yes, well, the excitement we have about this drug, lenacapavir, is it's something that is essentially 99.9% effective at preventing